feel like I say this on every show. I'm excited about the topic, but I think it's because we're always bringing a different perspective on everything. So no matter what the topic is, there's always like that little difference that, you know, what makes the wellness way. Because we think differently about everything. So no matter what the topic is, there's always something that we have to share about it because we think so differently about it.
Absolutely.
So today's show is going to be about birth control. My partner in crime, Bree, is off suffering in Hawaii. Must be so rough.
Darn you.
And we just keep seeing pictures of like the sun and the ocean. And it looks so lovely, but we'll have to go on without her.
Yeah.
But first of all, so I'm kind of going to interview-ish you.
Yeah.
Like, and just ask you questions because
Fabulous.
You have the brains and I don't. Because I like to, like, there's a lot of things that I can assume about birth control or things that now that I work for the Wellness Way I think about, but I don't actually know the science behind it.
Sure.
And so I'm wearing my white like doctor lab coat to try to feel smarter.
Oh, that's funny. I should have brought my lab coat. What was I thinking? Oh no, we don't do white coats here.
No, we don't.
And Dr. Flynn actually makes fun of it. He says we look like a bunch of butchers walking around
because
like
of
in
the
white coats.
Yeah, because of the white.
And did you know, this is kind of a fun fact. It's kind of off topic, but I was at my clinical rotation. So for those of you that don't know me, I'm a registered nurse in the Wellness Way Green Bay. I am finishing up my degree as a nurse practitioner. I'll finally be finished this summer, excuse me.
Yay.
Like 192 days, but who's counting?
Not that you're counting.
And then, and so we have these white coats, right? And I didn't know that the length of your coat determines your status. So like if you're short, you're probably like a resident student or something. If you're like calf length, that's like a nurse practitioner. Knee length is a physician and floor length is a surgeon.
Really?
Yeah.
So do you think that that's the case like on Grey's Anatomy too? Because I'm going to start watching.
Well, they're not all wearing like floor length, so probably not.
So probably not.
But anyways,
But anyway, I'm trying to look smart because you've got all the brains today. So basically, let's start with this. What's birth control and why do we need to pay attention to what it is and how it affects our body?
Absolutely. So, I mean, so people have very, very different views when it comes to birth control, right?
Mm-hmm.
Like when I was in high school, I never got a period. If I did, it was like once or twice a year, maybe.
Yeah.
And when they came, I would be laid out. Like I was so in so much pain. I would stay home from school. You know, I would faint.
Be miserable.
I would be miserable. And so, you know, and actually I take that back. I would get my period once or twice a year, maybe in college, but in high school I was getting them every month. But they were terrible, right? And so like, and who stays home for a period? Like I felt like that wasn't an okay excuse.
But
you just had to like deal with it. But if you haven't had super major periods in the past, like you don't quite get it. But if you've had that, that's a really big deal to have to experience that every month. And so for me, I went on birth control. Not because I was sexually active, but just because I wanted to be able to manage my periods. That's what my OBGYN put me on. And I was on birth control for the better part of probably like 6 or 7 years, maybe.
Oh, wow. Just for that reason.
Just to manage my periods. And I thought birth control was the best thing since sliced bread. I was like, this is amazing. And if anyone has had bad periods, you can relate that if there's a pill that you can take to make that more manageable, I mean, why wouldn't you?
Right.
I mean, like there was, we had posted some birth control things before, and someone had even comment, well, birth control saved my life. I'm so grateful for birth control because of how much better my periods are. And do they work to manage your periods? Yeah, they work really well. But they don't come without a lot of different side effects. And now working with infertility mostly here and other moms that want their hormones to be balanced, birth control is one of those biggest hurdles that what I do at the Wellness Way we have to overcome. And like there have been lots of moms that have been on birth control 6-7 years, stop the birth control and then never get a period, and they're like in a menopausal state. Their body never gets the hint.
It's just not functioning normally.
Yeah.
Because of that. I think one of my favorite quotes that I've heard, and I don't remember who has said it, but basically, drugs manipulate, emulate, and stimulate. Right?
Yeah.
So they don't actually fix the issue and like the root cause. They just mask it and make you feel better.
Yeah.
Right? Because you were on birth control for bad periods. It didn't
Right.
actually fix anything.
No.
It just manipulated things so that it felt better for you.
Right, exactly. And I mean, and so when we're talking about breast cancer, ovarian cancer, endometrial cancer, all these different cancers that are at a all-time high, so is our birth control consumption. And I'm not, I'm educated enough to say correlation does not mean causation. I know that there's going to be some people that comment, well, just because all of these things are high doesn't mean birth control caused it, which, I'm not saying that, but don't you think it's probably a pretty good correlation that if we are giving our bodies a bunch of endogenous hormones found outside the body, our body still has to filter it through, synthetic or not. It still has to get rid of it. And so if it's going down the wrong pathway, it can actually bind to and damage your DNA, setting you at risk for estrogen-based cancers. So if you haven't had your hormones tested or seen those methylation pathways, one of our favorite tests that we do a lot is called the Dutch test or precision hormones, and it'll tell you how your body's taking that hormone and getting rid of it. If you are having too much of some of those different types of pathways, you are at higher risk to develop some of these estrogen-based cancers like breast cancer or fibrocystic breasts or ovarian cancer, endometrial cancer. Actually, I take back the ovarian cancer one. I was just reading yesterday that birth control can actually decrease your chances of ovarian cancer because it literally shuts it off.
Oh, well, that
right. So if your ovaries,
either,
you know what I mean. But you have a higher risk for endometrial cancer, and you have a higher risk for breast cancer with birth control. But it's the opposite effect for ovarian cancer. But ovarian cancer is very rare
because it's messing with your hormones.
Yes. Yes. So birth control is always going to be an endocrine disruptor. Can I just kind of tell you how it works?
Yeah.
So if a woman,
an endocrine disruptor, what that is.
Okay. So,
I mean, some of us know. Like, I know what it is just because I've heard it said so many times. But when it was first said, I'm like, oh, what?
Yeah. So let's kind of backtrack a little bit. So the reason how birth control works is, throughout your month, you should have these ebbs and flows of your hormones, right? And when all of your hormones fall, that's what triggers a period. So it's rising with ovulation, then it falls, you get a period, and it's like this cycle, right? And it's necessary for your brain, your pituitary gland, to tell your ovary what to do, and vice versa. And so it's this negative feedback loop and all these things. So that's what is supposed to happen. It's supposed to, normal periods are anywhere from like 26, 27 to 32 days, typically, okay? Now, whenever we have a birth control come in, now what's happening is it's putting your regular hormones into a menopausal state, okay? So you have a synthetic hormone that's giving you the amount of hormone that you need to have that flow,
right?
Okay? So that you do get a period every month. People are like, oh, well, I get a period every month with my period. Yeah, it's not really a real period. Right. The synthetic hormone is what's making that happen. And yes, your endometrial lining does shed because you're signaling to the brain, hey, I'm having a fall in hormone. Right? And then you have that period. Or if you don't have that ebb and flow of the pills, which your provider can change the dosing of it, so you take it continuously, then you never get a period at all, which is an issue.
Depending on the kind of birth control, you might not get a period at all.
Yeah, exactly. And so, I mean, talking about the birth control pill specifically. So what the birth control pill does is it gives you enough synthetic hormone to then your body's like, oh, I guess I don't need my other hormones.
Right.
And they go kind of in this menopausal state. If you were to draw your blood, you would see that all of your hormones look like they're menopausal. Even though you might be having a period every month, it's just a synthetic representation of what a period could be. It's not your real period. So then your body has to take that and has to do something with it. And every time that it's responding to something, anything, listen, ladies, anything that is in your body that you were not born with is inflammatory. Right?
Yeah.
Whether that's a pill,
we can all agree with that. Right.
Whether it's a processed food or even non-processed foods that you're allergic to.
That's not supposed to be there.
That's not supposed to be there. Whether it's like metal fillings, IUDs, breast implants. We're seeing now and more that breast implants are screwing up women's hormones crazy. We need to do a show on that. And as well as root canals. I mean, anything that you were not born with or that nature did not create,
right. Right.
has the ability to cause some massive inflammation, and your body has to respond. It has to get those hormones out in order to function, because we were designed for homeostasis. We were designed to be able to adapt to these stressors. So when you're taking a birth control pill all the time, could it manage your periods? Sure.
And
it
it
could.
will.
But what your body does with that, if it's going down the wrong pathways, it can become destructive to your tissues, and it can cause your body to have to respond in an inflammatory state, and you can have a lot more issues down the road, whether that be cancer, whether that be infertility, whether that be anything hormonally based, depression even.
Right, it's all connected.
It's all connected.
So when you're looking at birth control, and a lot of people that watch this show are new moms,
Yeah.
like they just had a baby, and then you go to your 6-week follow-up. Okay, this is me. So I don't know if other wellness way people do this or not, or depending on how crunchy you are.
Sure.
But you go to that 6-week appointment, and okay, what birth control can I go on?
Yeah. Well,
So
actually,
what's safe?
as the labor
What are
and
the
delivery
options?
nurse, we're
Yeah.
supposed to ask them before they leave what their plan for birth control
Yeah.
is.
Right.
After you've just had a baby, like 24 hours, 48
Right.
hours ago.
You don't want to get pregnant right away.
I mean, no, you don't want to.
You have
You
a
don't want to
newborn.
get pregnant. So, nature by design, if you are a nursing mom, nature by design kind of realizes I don't want to have babies very close together,
Right.
and so what should happen is that nursing can kind of suppress those hormones, and you continue to have like postmenopausal hormones
Okay.
until you stop nursing, or until your body has some different stressors or things that change it. Now, that's how it should happen. Now, if you go into pregnancy and your hormones are not super balanced to begin with.
Or if you were on birth control before, I'm assuming that would affect.
Sure, if you're on birth control in
How
the
that all
past,
works.
or if you have mental stressors that's changing your hormones. And okay, what mom can honestly say that having a newborn is not stressful?
Is not stressful.
I mean, you're going to have some stress, right?
Yeah.
Whether you have some physical stressors, all of those things can make your hormones off balance, which is how those people can get those Irish twins, right?
Yes.
Those babies
Yes.
that are less than
So
a year
close
apart.
together.
Yeah. So breastfeeding is not a foolproof way of of birth control. So you shouldn't ever use it as a, well, I'm breastfeeding, I can't get pregnant.
Yeah.
Well,
You can.
you
Get pregnant.
can. And it's just a little bit different for everybody. And unless you've had them tested, you just don't know where you're at.
Yeah.
And so with that, it's really important to know. I forgot what I was
Some
asking.
alternatives, or like
Some alternatives.
alternatives, or what to pay attention to when you go in and you're like, well, what's safe? If I'm a breastfeeding mom, what's safe as birth control? They're going to tell you what's safe is, right? So you can go on the Depo-Provera, for example, or the pill or whatever, even though you're nursing, right?
IUD. They can do progestin only birth control.
Okay. Yep,
So
I've
there's
heard of
some that
too.
has like some progesterone and estrogen combined. For breastfeeding moms, you typically do progestin only, because if you add in that estrogen, it's going to screw with your supply a little bit. And so they do have a progestin only birth control pill. But again, all of these things are synthetic ways that are preventing you from getting pregnant. And so when you look at the Depo shot is one of the most terrifying ones, I think. Because when you get the Depo shot, it's supposed to stay in your system for 3 months, they say, right? And then after 3 months, you have to get another one. So once you get it injected, there ain't nothing you can do. It's in your
for 3 months.
For 3 months, it's going to be circulating in your bloodstream, and some people like that because they say, "Oh, I'm not going to have to worry about it. Just a one and done shot. I'm not going to get pregnant for 3 months." It
Don't
sounds
have to
fabulous.
go in very often. Yeah.
But then what happens if your body reacts, or what happens if your body can't handle that hormonal cascade? You're stuck for 3 months.
Yeah. And there's nothing you can do to back out of it at that
Right.
point.
Where like an
like
IUD
if
can
you're-
always be taken out. A birth control pill can always be stopped.
So is an IUD safer? I mean, I've heard people say, like, it's not a chemical, right? Or
So
how
there's
does that
lots
work?
of different types of IUDs, actually. There are some that do release a small quantities of hormone, okay? And when you're releasing small quantities of hormone right in the uterus, that can be problematic for me. That's just something that your body is extra that's responding to. Then they have the copper IUD, which some people say the copper IUD is better because it doesn't have hormone in it.
Yeah, and that's what I mean, just before thinking wellness way and before thinking differently, that's what I would say is, well, that's a safer option, right? Because it's just copper.
Right. I mean, and I have always thought too, like, oh, could I recommend that to my patients? But I always come back to the point of, It's a metal.
Yeah.
It's something foreign. You weren't born with it.
Right.
Your body's it's still something that's there that wasn't supposed to be there,
Right.
that your body's gonna have to respond to, right? So anything that's there,
Yeah,
think about walking around with a splinter in your finger
Right.
all the time. You know, I have a splinter
Yeah.
in my finger, and
Yeah.
you know, it's not really causing any harm, but it doesn't feel good, right?
good.
There's inflammatory cells going there. It's constantly trying to repair. If you left that splinter in long enough, your body would eventually just absorb it.
Right.
You know, but it's
Yeah.
going to be constantly inflammatory. Same thing with an IUD. You just don't want to put things in there if you don't have
Yeah.
to, right?
Right.
Now, there are some non-hormonal options. Like one of them that I recommend to my patients a lot of times is like a diaphragm. Which all that does is it blocks the cervix. You can insert it, you can leave it in for up to 24 hours. You can even get some with spermicides, but that does change the pH of the vaginal canal. That's not the best. But with that, it kind of blocks the cervix so that the sperm can't get up into your uterus, right? So that's one non-hormonal way. Obviously, barrier methods like condoms. Some people...
Organic condoms.
Organic condoms. Some people like
just
to
any
do
condoms.
the... combination of both to be very safe.
You
know, I have
pregnant?
one mom that definitely didn't want to get pregnant. She did diaphragms, they did organic condoms, and then he made sure that, you know, to try his best to pull out at the same time.
Yes. Right. So a combination of
like,
three
they're like, we are
things.
not getting pregnant.
Just make sure.
So just kind of all those layers.
Right.
But so, you know, those are some non-hormonal ways. The best
Yeah.
way to know is to know your period, know when you're
Know your
ovulating.
cycle.
You
Yeah.
can only get pregnant if you've ovulated.
Yeah.
You know, you're in the very beginning and the very end of your cycle, that egg isn't there anymore. You know,
So
it's
track
about
it. I'm
track
guessing
it.
there's apps for that.
There's
and-
apps for that. Natural family planning has a lot of different resources that you can learn to do some of that. You know, tracking the your cervical mucus. You know, is one way that can kind of say, okay, yes, I've just ovulated, because what's really crazy is that your mucus changes when an egg is released, so that the sperm can actually penetrate it. If it's not that nice egg white thing, then the sperm actually halts.
That's the technical term.
Thing. If it's not like a nice egg white consistency, then the sperm can't penetrate it. So
Okay.
it's kind of like a barrier in that your body creates. It's
Yeah.
crazy.
Wow.
There's so many things.
That's fascinating.
There's so much
All that
science behind it.
Yeah. Right.
And collagen and blah, blah, blah. But we don't need to bore you with all of that.
Right.
But, you know, those are some options that people can use.
As alternatives.
As alternatives. Obviously, you can't get pregnant if you don't have sex.
Right.
But
So
what
that's-
married mom
abstinence
is not
is
gonna
the safest way to avoid.
always. So for all the 16-year-olds that are watching,
Yeah, right. Hopefully there aren't any watching.
yeah.
So kind of on the opposite side of that, basically, you know, using 3 different kinds of alternatives to, well, I was on birth control and now I want to get pregnant.
Yeah.
Now what? Like you're
Yeah.
on birth control for, you know, X amount of years. You were on it for 6 years or
Yeah.
however long that was. I have my own story to share that we can get into a little bit later, but that's for next week.
Sure.
With my story, but I was on Depo-Provera
Sure.
and was on it for, you know, 5-6 years.
Yeah.
And what would you recommend to somebody who's been on birth control and then it's like, okay, let's get pregnant or let's start trying? Because this is what you see with infertility.
Yeah,
You know,
yeah.
and people coming in struggling to be able to get pregnant.
Yeah, and this might surprise some of you guys that are watching, but actually, you know, I see a lot of mostly women, and a lot of them are, the vast majority of my infertility cases actually, probably about half are wanting a baby for the first time, and the other half are wanting 2, 3, 4, and they can't. They had no issue with number 1.
Oh.
But then after being postpartum, something happened with their
Right.
hormones, or maybe they tried some birth control in between so that they wouldn't have,
get pregnant
would get
again,
pregnant
yeah.
right away. And then now they come to me because now they're wanting a sibling for their other one, and they just can't. Secondary infertility
yeah.
is something that's not talked about a lot. That's
Wow,
really
yeah, I guess
an
I wouldn't
issue.
think of that.
Yeah.
Because if you're naive, you think you had one.
Yeah.
You had one. It
was
works.
just fine. You know, maybe
It's
I
one of
wasn't
these,
even
like-
expecting that one.
Yeah.
And then,
It's like, well, you know it works because you were able to have the one, but then something gets off and you
Yes.
can't figure it out from there.
Yes.
So if they're on birth control, if it's their first, or if they're starting to plan, or
Yeah.
What
So,
are they
I mean,
next?
if you're ready to start trying, remember that it's going to take a while for that hormone to leave your system. Like it has, I tell my moms, they're like, okay, stop my birth control. Can I test my hormones? You could, absolutely, but it's not going to give you a really good representation of what your hormones are at because there's still some synthetic stuff in there. They say on there at least 3 months from the medical community is how long it takes for it to leave your system. So I tell my moms between 2 and 3 months we can maybe test your hormones. But we do know that that some of that estrogen can be stored in your fat tissue, especially for women who are a little bit maybe overweight. It can be stored in their fat tissue, and it could take even longer to come out because your fat tissue makes estrogen, and then it also stores it. So if you have extra, it could store it, and it might kind of take a while for it to completely leave the body. And so for that, it can be devastating because sometimes if the ovaries have been suppressed for so long, they have this thing called ovarian atrophy where they start to kind of shrivel up because they're not needed. Okay, so if you've been suppressing your ovaries for years and now all of a sudden you want a baby, well, what level of ovarian atrophy is there? Some of that stuff is hard.
So if you wait the 3 months and you assume that these synthetic hormones are out of your body, do you just start trying to get pregnant or get tested first to see where you're at before you get pregnant? Because we've had these shows and these topics before where we say sick moms make sick babies.
Yeah.
So how do you get healthy, or how do you prep to, for that?
There's a lot of research out there right now that's kind of budding, that's been around the past 10 years or so around this concept called epigenetics and how that goes along the line of sick moms make sick babies. And with the epigenetics, the concept of epigenetics is that the womb environment can either set a woman up for success with the future health of her child, or it can start to turn on some different genes that could set them up for sickness. So we could have, that's how you can have babies that unfortunately are born with cancer or cystic fibrosis or all of these different genetic disorders that we chop up to genetics, which of course it's a genetic component. However, creating that womb environment to at least the least amount of inflammatory inflammation possible is going to really set you up for success. So I always tell my moms, if we can kind of get your hormones tested, see what they look like, and start to prepare that womb environment, go through a detox together to be able to really set your child up for success. You might not realize it from the moment that they're born, but 50 years, now they're 50 years old and they have hypertension or not, could stem back to mom's pregnancy.
Wow.
Isn't that crazy?
That is really crazy.
And so with that, we're trying to figure out how to prepare the body the most. And by decreasing inflammation and doing a detox and kind of preparing that is great. On a very, very, very basic level, because someone's always going to want a little bit of free things that they can do.
What can something I can do?
A very, very basic level, there's been a research that just came out last year that's talking about omega-3s and the power of omega-3 fish oil in decreasing inflammation within the uterus. So on a very basic level, at least you could take some omega-3s, that's going to do something for you. But I think finding a wellness way doctor or finding somebody that can help guide you through this to set both you and your baby up for success is really invaluable. And it's something that not a lot of people are doing. That I think makes a really big difference in the outcome.
Yeah, and especially, and this kind of leads into next week too, with my story and not knowing, period, right? I mean, that's really what it is, and that's really the point of what we do and what Bree and I do on this show and all of our shows is to put the information out there to get you to think differently and to get you to realize that you can do research on this stuff and it's out there before hindsight is 20/20 and you think, well, maybe I should have done this differently, or maybe I was sick and I didn't know I was sick, or different things.
With birth control, right? You talked in the beginning about how a lot of people go on it because of such terrible periods.
Right. Yeah.
Well, you might be shocked to know that there's a way you can have not such terrible periods without the use of birth control by figuring out what your hormones, are doing. Pulling extra hormone out of the body, getting those hormones balanced. You know, I get messages from women all the time I've been working with, and they're like, oh my gosh, for the first time in my life, I went to the grocery store during my period.
Oh my gosh.
Like, that's a big deal. Like, if you have, like, you know, I have a lot of women that have endometriosis and polycystic ovarian syndrome. It can be debilitating. And for someone to be able to go to the grocery store day 1 or 2 of their period when it's supposed to be the heaviest is a huge victory.
Yeah, but to be able to get ahead of that and pay attention to that, you know, and go into it with intentionality. Yeah. You know, even if you're looking to get pregnant and things like that, paying attention and thinking long term. You know, like when you were 16 and you just did that because the doctor said it would be good for you or it would help you, or they had the white coats on and you just assumed that they knew. You know, like
and I was like, this is wonderful. Oh my gosh, like I don't have these terrible periods, but it didn't come without some weight gain and some other things. You know, there's no wonder drug out there,
and as then long to see long term what that looks like now.
Exactly, and I mean, and we struggled with my first, and you know, it's been a journey trying to figure that stuff out, and I thank God for it because that journey is what has inspired me to learn more to be able to help other women. But you know, it's never too late. It's never too late.
No, it's never too late. That's a really good point. Yeah. So, I mean, that's pretty much all we had for today. And you have patience.
I do.
Like in 2 minutes and 50 seconds.
Actually, my patient, I think, in 2 minutes is from California, which is fun.
Oh, that's awesome. Yeah, go to our website and the website looks awesome. There's this fancy little map on the homepage that shows all of our clinics. So if you're looking for a clinic or if you want some of that testing to find out where your hormones are at now, go to our website and we've got all that information on there. So until next week, Bree will be back and we'll be talking about my story with birth control and my daughter Layla. So we will see you next week, Monday at the normal time.
Bye.
Bye.